Hi, it's David Ayres from Core Physiotherapy and Pilates Studio. Today we're going to talk about hamstring strains and how we as physios can help you through the rehab process and back into sport. Hamstring strains are one of the most common injuries that we see from sporting activities. In spite of many years of research on how to prevent them, they're still the #1 injury in AFL football, both for injury prevalence and for the number of games missed. So they're a pretty serious thing in a lot of sports. The hamstring makes up the back part of the thigh. So if we have a look on Olivia here, it actually is composed of 4 separate strands of muscle, basically through the back of the thigh here. So just like so, around these sorts of areas. It's responsible primarily for bending the knee. So if we get Olivia to flex her leg there, and then back down. And it's also a hip extensor, so it gets the leg to come back off the ground as well. So just lifting your leg up, extending back, and then back to straight. So how do you know when you've strained your hamstring? The classical history of a hamstring strain is the sudden onset of pain in the back of your thigh, typically during an explosive sprint activity. So it typically means that you're unable to continue the sport. In some cases, you may even be struggling to walk because of the pain and dysfunction that occurs because of the injury. It generally happens, you'll notice, more when the foot's actually in the air, trying to stretch out, and the hamstring is actually trying to slow down the leg, rather than it being actually when you're pushing off the ground. Despite all the research saying that there's not much we've been able to find to prevent hamstring injuries, we do know that the one thing that we can guarantee from the research is that having a graded program under the supervision of a physio, when you do injure your hamstring, can greatly reduce the risk of re-injury and also ensure that you are back into your sport at the same physical condition that you left it. Okay, so when someone presents with a hamstring strain, we start by trying to identify the exact location of the injury and also the degree of the injury. So some of the things that we quite often look at with these are just to start with just looking at whether they can actively use their hamstring, whether they get pain doing that, and then testing the actual strength of it. So getting them to pull up against me there and seeing if they really have much strength through the muscle at all. The other thing that we can do is really feel around to feel what particular muscle out of those 4 strands of the hamstring have been injured. Sometimes we might even feel a little gap in the muscle, which is a really strong sign that we've done probably more of a significant injury to the muscle. But that's coupled in with the other assessments like the muscle length, the strength that we've exhibited. But they all give us a good idea as to what the likely sort of rehab timeframes are going to be for recovering from that injury. So in terms of the starting of rehab really should start straight away after the injury with our typical things like our rest, icing, compression, elevating. But we can also start quite soon doing some of our soft tissue work to try and relax some of the muscle around the area of the injury. So we can also use some things like dry needling techniques for that as well. On top of that, we really want to get on to getting into our rehab phase very soon. So some of our rehab exercises can actually start day 1 from the injury, just to try and make sure that we manage and don't get any complications from that. So simple things like just doing some active movement of the leg, just to make sure that the scar tissue around the injury doesn't form too quickly, are really useful. So getting onto these things very early is particularly good. So looking at the rehab phase of things, we're looking at getting strength back into the muscle, but also we're starting to work on our graded return. So building general strength around our lower limbs in general, and getting into a running program, stage by stage to get you back to sport, back into training, and safely return to the sport of your choice. So getting the right rehab program there is certainly important for minimising the risks. The other thing is when we've got the opportunity to sit back and look at why we've injured our hamstring, we quite often identify some risk factors along the way that might have been things that were potentially things that caused the injury in the first place. So we might look at some of the risk factors like having lower back pathology. So quite often people that injure their hamstrings have some early stages of degeneration in their lower back. that can cause some of these connection changes that potentially cause an injury. Poor running mechanics, so particularly people that overstride, they can have these sorts of injuries more often, we find. So trying to correct their running mechanics and make them run more efficiently so they put less strain on their hamstring. And also things like just generally having poor core stability around their hips and pelvis. We can work on all those things while they're in the rehab phase and hopefully try and reduce their risk of re-injury when they return to sport. So in closing, I guess the key thing with hamstring injuries is getting onto our rehab program nice and early, and that's going to really help us to minimise the risks of recurrence, which are really common with hamstring injuries, but also get us safely back into sport at the same level where we left it. If you'd like more information on hamstring injuries, then you can check out our website, but more importantly, get started on your rehab as soon as you injure it. So make a timed book in with your physio and get that plan started.